Hi, I'm Jeremiah. I'm a nursing student at Winston-Salem State University. I'll be walking through a patient interview, brief patient interview and family history, as well as a hair, skin, and nail assessment. I do have some tools in front of me that I'll be using or have used. So we have a tape for height, for measuring height. I also have a thermometer for measuring temperature. I have a sphygmomanometer for measuring blood pressure. I have a stethoscope for measuring blood pressure, a scale for the weight of the patient, and gloves for PPE. I have patient A here who has consented to being videotaped during my assessment. Thank you very much. So during an assessment, you want to make sure in the clinical environment that the room is secure, that the patient will be vulnerable at some point, so you do want to make sure that staff outside the door know to knock before coming in, or that you have a lockable door to help with safety of the patient, as well as a well-lit room. Natural light is ideal. Fluorescent light can be used just as well. It helps to have some sort of flashlight. If you're assessing the scalp or hair, sometimes that area can be dark. You want to be able to focus a light for a better assessment. So today I have patient A, and we're going to run through her. You want to make sure the patient knows the schedule of the assessment and how you're going to work through the assessment. So patient A today, we're going to be working through your family history and your brief history, as well as we're going to get some vital signs, and then we'll start your actual skin assessment. So for the sake of for the interview, I have already taken the vital signs using the tools I had laid before. Blood pressure was 105/61. Patient's temperature was 98.4 degrees. Respirations were 18 respirations per minute. The pulse rate was 61. The patient had very regular respirations and regular pulse rate. If you notice a dysrhythmia when checking the pulse rate, or a higher or irregular respirations, you can assess the respirations for an entire minute. Otherwise, it's standard practice to assess for pulse and respirations for only 30 seconds and double that number. I wouldn't count for only 15 seconds and then multiply that number by 4, as if you miss during one respiration or one pulse, that number is offset by 4 beats. So during an assessment, like I said, make sure the patient is aware of everything that's going to be going on. So patient A, can you tell me, do you have any family history of any skin integrity alterations at all, or any alterations in skin at all?
No.
No? Okay. Okay, do you have any allergies?
I'm allergic to poison ivy.
You're allergic to poison ivy. Okay, and you just get a rash from that?
Yeah, rash, blisters, it swells up, it's painful and itchy.
Okay, so you have a severe allergy then?
Yes.
Alright, any problems with your airway when you have a poison ivy reaction?
No.
No? Okay. It's important to, whenever noting an allergic reaction, the severity of that reaction, and if the patient's airway is involved at all. It's also very important to note during the family history, if the patient has any family members that have psoriasis or eczema, as these can be passed down in the family tree. You want to also note the patient's overall pigmentation. If the patient is lighter in pigment or darker, that'll also let you know, to specifically ask, maybe possibly a pale patient or a lighter skinned patient would be more susceptible to sunburns. Although a darker patient, it may be a little more difficult to assess some areas without a light, or if the room is not quite in the best and optimal lighting. Moles can also be very difficult to distinguish in darker skinned patients. Now we're going to move to the skin assessment, or the hair, skin, and nails assessment of this patient. I'm going to start with assessing her scalp and work down from there. So for assessment of the scalp, I do have some PPE here. I have 2 gloves, which I'll use to comb through her hair. When assessing the hair, you want to part the hair and look at the scalp. So you do want to part and look all the way down to the scalp. For any excessive dryness, you want to look for bald spots or alopecia. You also want to assess for excessive dandruff, which could be brought on by some pruritus, some chronic scratching, ringworm, lice. You do want to assess for lice, so you always want to assess the hair, scalp. Feel through the hair, comb through the hair, and make sure there's no foreign objects or articles in there or anything you could have missed in that time, and everything seems fine there. With female patients, you also want to make sure their hair has been put down. It's not in any kind of a hair tie, as that could impede, getting to the scalp, actually making your way to the scalp. So now I'm going to actually start looking at some of the skin. So you do want, as she turned her neck, you do want to make sure you look behind the ears on both sides. If you can turn this way. You do want to make sure to assess the back of the ears, and then work your way down. So we'll check the neck. Alright. You want to look for any asymmetries in neck muscles. Any asymmetries really, period. So with the patient having their eyes closed, you want to check for any asymmetries in the skin folds of the eyes, and work down to the nose. Make sure the nose is of normal size and shape, not deviated to the left or the right. Working down to the actual skin assessment, you want to make sure you look through pretty thoroughly. Note any rashes, erythema, cyanosis, jaundice. Jaundice has a liver pathology, so you want to make note of that. Any erythema or excessive redness, you can use the back of your hand as kind of a thermometer to kind of tell if that area is inflamed. Then working your way down the hand, you're going to look at the nails and the nail beds. Here is where you can assess for cyanosis. If the nail beds or the periphery of the hand is a little more bluish in color, that's a sign of hypoperfusion or decreased perfusion. So work down there. Always want to take a look at the palms. The palms can take a lot of abuse throughout our everyday living, and we use them a lot. So you want to check for any bruising, scrapes. Always check in between the fingers. Very good. Check the nail beds. All right. In chronic iron deficient anemia, the nails can have a spooning type look. Need to make sure that's documented. All right. Thank you very much. All right. And now, any moles you may have noted, make sure you have some sort of measurement to kind of take a measure of the diameter of that mole. And anytime you're dealing with moles, you would follow the monogram A, B, C, D, E. A for asymmetry. You want to look at B, the border of the mole. If it's got a nice smooth border, or if it seems to reach out into the other skin, that can be a sign of a melanoma. C, you want to look for the color of the mole. And more importantly, if the color of that mole has changed, if the patient has noticed that mole taking on a different hue or different color over time. So D, you want to look for the diameter. I think rule of thumb is anything over 6 millimeters. That could be a cause for suspicion and may need to be looked into. And E, elevation of that mole. Elevation of a mole could cause it to be more easily irritated by garments of different texture. So I'm going to ask the patient if she wouldn't mind to roll to her left side. So this way you get a great view of the patient's back. You can check the neck. Very important to check the back of the arms, as that's often overlooked. You can have the patient have his or her arm over her head and assess into the armpit here. It's a great way to kind of minimize the folds that causes creases and you can't really see into very well. That'll help you can find some areas of maceration in some patients where the skin on skin or moisture has caused some slight skin breakdown and problems with skin integrity. In this position as well, with a male or female patient, you can assess the gluteal creases for skin integrity alterations, as well as the back of the leg here. So you can, usually in an area that would be creased when a patient is standing up, you can get a good assessment on. You can also assess the patient's heels. There's a lot of different assessments for the foot. You want to make sure you're assessing in between the toes for any excessive dryness or scaly irritation like a dermatitis, or it could be a fungal infection, athlete's foot. That will also have a notable odor as well. With kind of knee down or shin down on patients, diabetic patients, you want to make sure to note the color. If there's any changes in hair, that could be caused by arterial alteration in perfusion or venous return that can give the shin area a purple color in nature. And decreased hair can be a sign of the arterial or perfusion issues. You want to make sure to pay attention to the feet of all patients, especially diabetics and the elderly, or patients that are bedridden. If they're bedridden or constantly in the bed, you want to check the heels for any alterations in skin integrity or compromised areas of the heel. As they lay on the bed, the bed may cause some type of ulcer. So it's always good to assess the heel. You can roll back over. All right. Thank you very much. So all in all, that is my hair, skin, and nails assessment of a patient. I appreciate your time. Thank you very much.